I'm very grateful to be invited to this meeting. I've never been to the UK Oncology Forum before, and I've been asked to talk about surgery for men with metastatic, specifically oligometastatic prostate cancer. That's an area that I'm interested in. I run a UK trial called TRoMBone, which stands for Testing Radical Prostatectomy in Men with Prostate Cancer and Oligometastases to the Bone. It's a feasibility RCT, randomized controlled trial, run across 9 different centres, UCLH being the lead centre, but other centres in London and across the country. And we're randomising men between surgery plus systemic therapy for oligometastatic prostate cancer versus systemic therapy alone. And we've already finished recruitment 4 months ahead of schedule. And so now we're just finishing the follow-up, finishing off the surgeries and looking at the outcomes. It started off quite poorly received. We didn't have any recruitment for the first 3 months. I think part of the reason for that was because it's quite a controversial subject to operate on men that have got advanced disease. People didn't know whether it was safe, didn't know if it was feasible, and also because chemotherapy became a standard of care management while the studies had already started. So we had to change the protocol to allow chemotherapy to be given before surgery so that all patients got chemo as well as the hormones before they had surgery. And that got the oncological community, like this audience, on board. Such that actually most of my referrals have come from oncologists rather than urologists, and really the oncology community has really sort of taken the study on board, so I'm very grateful for that. And there's lots of questions to do with the biology of the disease that hopefully we'll be able to answer, because we're also collecting tissue from the samples that are having surgery, because normally you don't have samples because these men don't get operated on. So it provides really a unique resource that will also have tissue samples from men with metastatic disease, and some clever oncologists, I guess, could do some translational work behind that to try and figure out why these men are developing metastatic prostate cancer and how they're progressing.